Welcome to my channel. My name is Emi Devi and this is Health Matters. So what about this blog? It pertains to health. When we talk about health, we mean what physicians do, oncologists, orthopedic surgeons, ophthalmology surgeons, and all the other cadres of physicians and doctors. And then we talk about the different cadres we have in healthcare. We'll try to orient you on, I will try to bring them on board so that they'll explain exactly when you have a certain problem, which specialty do you check. And then we'll try to see the different cadres in healthcare that we have and try to understand when we talk about a nurse did something, and exactly it is a nurse who was meant to do that. Because what I've noticed currently in social media, you find that a problem was created and made by a nurse, then you find a pharmacy technician is being blamed, or it's an activity that was meant to be done by a physiotherapist, for example, then you blame an occupational therapist. Do we really understand what all these people are meant to do and what they have not done and how we are supposed to cooperate with them? Another thing we look at in this Health Matters YouTube channel is the different health components as per the WHO guidelines. For example, to have a proper health system, you need to have proper governance. When somebody tells you about proper governance, what exactly do they mean? And when we talk about leadership in healthcare and management, where do we place these things? And then we'll talk about healthcare workforce. Sincerely, if we had a proper ratio in healthcare workforce, we could not be complaining. But sometimes they get strained or they are overstaffed in a certain place, and you wonder why we have so many obstetric gynecologists in one area, and another area we don't even have a medical officer. We'll try to see how WHO defines all these factors to make a health system work efficiently. Then another component we are going to look at healthcare is the healthcare financing. Where does insurance come in? Where does NHIF come in? And what do we mean by user fee? And what exactly do we mean by pooling money? And what are the advantages of something? And then again, what are we meant to do as an individual to ensure that healthcare does not make us poor? And what is expected at the policy level, where we spoke about governance in healthcare? What are they supposed to be doing so that we balance? I hope we will try to make it simpler so that it's better. We have another component in healthcare. This other component of healthcare is data. This healthcare data, when you go to a clinic, you are told, oh, what is your name, age, where do you come from, and all those statistics that are collected. Do we make decisions? When you're making decisions of getting a certain specialty in place, for example, when we import a specialty from one place, do we have a reason why we are importing this person from one place to another? If you're making decisions as per the statistics, I know Kenya, we have so many learned people doing informatics and what is that thing called? Please tell me, if you do that course, please tell me what it's called. I'm trying to remember it. So when we have all these people doing monitoring and evaluation, they are using specific statistics. So are these statistics reliable? Are they accessible? Are they accurate? How do we assess the accuracy? That's another component, and many more components of health, especially infrastructure. By the time you're bringing up a health sector, what should be in the front? What should be behind? What will you walk in and find? How are the areas accessible? Yes, all those things. Then we'll come down and look at the patient rights. What rights do you have as a patient? And what duties do you have? So that when you go to a health facility, you will know that it is your right to be given something. But you don't have a right to fight a health personnel who is not treating you right. And you also do not have a right to stop taking medication that you are meant to. It becomes your duty. When you're being told, take these drugs for this duration, you have a duty to take that medicine. Yes? Right. I think we are good. Then again, what are our expectations? When I walk into a certain facility, what should I expect? I should not expect to get mental treatment in a facility which does not have mental facilities. Exactly that. So when you assess the health facility to go and get managed, you should know where you are going for what. So that again, you do not waste a lot of time in making critical decisions in your management. Then finally, my passion, quality in healthcare. We will address what quality means, so that by the time you are an employee, you are an employer, you are a patient, you are a community, how do you judge quality? And I know we are going to learn. Tell me more. What do you want me to focus on? What do you want me to tell you? What do you want us to discuss? What speciality do you want me to bring on board? Where do you want us to move forward to? And all of us will learn in one way or the other. Welcome, subscribe to my YouTube channel, Emi Devi, and God bless you.